If you've been setting goals that never seem to get done and you want to learn how to actually make progress, then this video is for you. If you're new to the channel, my name is Siju Jacob. I've been a private practitioner for the past 25 years in Bangalore and Dubai. I've been using a surgical microscope in my private practice for more than 20 years, and I've been training dentists how to incorporate the surgical microscope in everyday clinical practice for more than a decade. If you've been here before and you found some value in the videos that I post every week, then don't forget to click on that subscribe button so that you get notified every time I upload a new video, which is usually every Sunday. You can also subscribe to my weekly newsletter. I've put the link in the description below so that you get even more useful information delivered right into your inbox every week. In 2022, I set a goal for myself. I was going to create an online course for dentists that teaches them how to use the surgical microscope in everyday clinical practice. 2022 went by, and did I achieve my goal? I didn't. I moved the same goal to 2023, and I decided that I am going to create an online microscope training course for dentists in 2023. 2023 too went by, and nothing happened. In 2024, I decided to do something different. Instead of just setting random goals, I decided to put systems in place. I decided that come what may, every 2 weeks, I was going to shoot one video at least. So we did this. Every 2 weeks, come what may, we would just shoot one day in the clinic, and then we would let another 2 weeks pass by, and then we would shoot another episode after 2 weeks, and this went on one by one. And we didn't really focus on the goal as such. Our only goal was that every 2 weeks we would shoot one episode come what may. And then bit by bit, one led to another, and before you know it, in about 8 months, we had the entire microscope training course ready. So the difference this time was we put systems rather than goals. I first heard of systems versus goals from Scott Adams, the creator of Dilbert, and he said something very provocative. He said that goals are for losers, systems are for winners. In this video, I'm going to explain what exactly Scott Adams means when he says that systems are far better than goals when it comes to achieving some project that we set out to achieve. So to make this a little clearer, I'm going to explain systems versus goals using two examples. First example is a non-dental example, and the second one is a dental example. For a non-dental example, I'm going to take the example of someone who is trying to get fit, who's trying to get into physical shape. And for a dental example, I'm going to take the example of someone who wants to learn how to use a surgical microscope in everyday clinical practice. Now let's use these two examples to understand the problems with just goals alone rather than systems. Goals rely largely on willpower. If you get up in the morning and say, I'm going to lose 10 kilos, that willpower alone is not enough to sustain you for the duration that you need to sustain in order for you to lose 10 kilos. If you are relying on your willpower alone to bring in a surgical microscope and learn how to use a microscope and become very good at it, then it's unlikely that willpower alone will sustain and help you reach that goal. We need systems instead. The second problem with goals is that goals are all or nothing. Let's say you take the example of you want to lose 10 kilos. Until the day when you actually lose 10 kilos, you feel like a loser. Whereas systems aren't like that. In a system, you aren't looking at 10 kilos. Your only goal is, let me work out every day for the next 1 month, or let me just work out today. So if you go today, you always feel like a winner because that was your system, right? Your only goal was to go today, and the minute you go to the gym and come back, you've achieved your systems, what you set out to do. It's very different from a goal. So the problem with goal is, let's say you went to the gym for 6 months and then you couldn't go. You start feeling like a loser because you feel you haven't achieved your goal. But if you keep your attention on systems, then you feel good because no matter what stage you give up, you've still done something. So you don't feel like a complete loser. So that's the second difference of having a systems-based approach rather than a goal-based approach towards anything in life. The third difference between systems and goals is that goals don't give you a process to get there. It just gives you a dream, whereas systems gives you a definite path to get there. So if you are relying on only goals and you're just hoping that one day you're going to reach there, for example, if you say that one day I'm going to learn how to use the surgical microscope in my clinical practice, then that is too difficult a path because you don't have a process in place. And the problem with those kind of goals is that life always tends to get in the way. Whereas if you have a system, then you are only bothered about what is the next thing that you need to do on that path. So these are some of the key difference between systems versus goals. So let's say you want to achieve something, and let's look at it from a systems versus goals-based approach. How do you put systems into place if you want to achieve anything in life? Let it be dental versus non-dental. So let's look at these two examples and let's see how would we achieve these goals if you wanted to achieve them in the first place. So the first thing you have to do is you have to clarify your intention or clarify your goal. Goals by themselves are not completely useless. You at least need to know where you're planning to go in the first place. So you take the example of someone who wants to lose weight. You know that my goal or my destination is, I hope that at some point in time, I'm going to lose 10 kilos. Okay. So that's, you set your intention. Or if you look at something like learning a surgical microscope, your intention is that at some point in time, I want to become really comfortable with bringing in the surgical microscope into my dental practice and then become really good at treating patients every day using the surgical microscope. So you set your intention. This is step one. So the second thing you need to do is you learn and collect knowledge towards whatever goal or intention that you're trying to achieve. For example, if it is physical fitness, then you start doing your research. You watch YouTube channels, you buy some online courses about physical fitness. You try and understand what you need to do to get to this goal of losing 10 kilos, right? So this is the studying part. So the difference between a goal-based approach and a systems-based approach at this stage is that a part of your system is that every time you will just dedicate half an hour to just reading or gaining knowledge. We are not looking at the final goal at this point in time. At this point in time, the only system we have is that every day I'm going to spend 30 minutes learning more about this topic that I'm interested in. When we look at microscopes, again, you just collect knowledge. So you don't have to buy the microscope. You look online, you buy a microscope training course. You don't have to buy my course. You can buy anybody's course, or you can just look at YouTube, or you accumulate information as to what exactly you need to do to buy this microscope and start learning it in your clinical practice. But the difference is that you're not just looking at the goal. You are spending 30 minutes every day, and that is a system. You are going to make a decision that come what may, I'm going to read about this particular topic for 30 minutes every day. And that's the system that you put into place. Stage 3 in a systems-based approach is that once you have enough knowledge, you work backwards from the destination. You look at what is the minimum viable step that I need to do every day or week or month so that I can walk towards this goal. So for example, you've identified your goal and you've learned enough about it. Then you move to the next step, which means you go to the gym. In the example of a physical fitness, you might go to the gym and then you might find a trainer and you might say, okay, I'm going to just go half an hour every day and then evaluate. Right? So you're not looking at, I'm going to go there for an hour or 2 hours every day. You start with half an hour and say, I'm just going to do this basic step. So that's how you work backwards. In the case of microscopes, once you've had knowledge of what to do, then you probably make this decision of buying the microscope and bringing it into your practice. And then you would make a systems-based approach where you say, I'm going to practice 30 minutes every day using a mannequin in my practice with the lessons that I learned from an online course. So that's what we mean by a systems-based approach. The fourth step in a systems-based approach is we make the next step stupidly small. We make it very small so that it's easy to implement every day or week or month. In the example of physical fitness, you could just make it very small. Rather than say, I'm going to the gym and work out 1 hour a day, you're going to say, I'm just going to go there for 10 minutes. Okay. So you make it stupidly small and then you try to do this for 6 days or 10 days. And then you stretch this to a little more, maybe 20 minutes. And you keep evaluating how much you're progressing based on the system. You're not looking at how many kilos you lost. You're just looking at, am I following the system or not? Similarly, when it comes to microscopes, all you're doing is you are kind of putting a system in place where you say, come what may, no matter how busy I am in my practice or how tired I am going to spend 20 minutes a day trying to practice on a mannequin with the microscope so that I can get better. So this is step 4 in a systems-based approach whenever we are trying to learn something new. And the final step in a systems-based approach versus a goals-based approach is that we measure the system, not the goal. You aren't going to measure and say how many kilos you lost or whether or not you lost 10 kilos, or in the case of microscopes, you aren't going to go back and say every day whether or not you know how to use the microscope the way an expert does. All you're doing is you're measuring the system, whatever system you put into place. So in a physical fitness, you would say, did I go 6 days a week or 5 days a week? The system that you put into place, did you follow that or not? So that's what we call a systems-based approach. Or in the case of microscopes, the only thing you're going to track is the system, not the goal. So in the case of microscopes, all you're going to track is, did I spend 30 minutes a day or 20 minutes a day trying to learn the microscope come what may. So you measure the system rather than the goal. So these are the key differences when we have a systems-based approach rather than a goal-based approach. If you have a systems-based approach and you do it for a certain period of time, invariably you achieve your goal. That's the beauty of having a systems-based approach. And like Scott Adams says, you always win with a systems-based approach. So I hope that this gives you a clue as to what to do if there are some long pending goals that you try to make every year but somehow fail to achieve. Why not convert to a systems-based approach rather than a goals-based approach so that you start making progress and eventually achieve the goal that you set out to do. If you enjoyed that content, then maybe you would enjoy my weekly newsletter, which is a short email that I send out every Wednesday. It's usually filled with some useful dental and non-dental information. I've put the link in the description below. Do have a look and subscribe to my weekly newsletter called Wisdom Wednesdays. Don't forget to click on that subscribe button so that you get notified every time I upload a new video, which is usually every Sunday. And if you enjoy content like this, then maybe you should check out some of my other videos on this channel coming up over here. I'll see you next week with another video. Till then, take care. Thanks for watching.